and a lot is happening across the country with respect to influenza cases. Several more cases are now being reported, but there seems to be a difference now. Unlike earlier, what we are being told by several patients is that the duration of the sickness seems to be lasting longer. Where a normal case of influenza would last for a week or so, many of the patients now are complaining that it's lasting for 2 weeks or even more in some cases. Hospitalizations are on the rise, but also the fact that even after recovering from, say, fever, they have a prolonged cough or even prolonged sickness for that matter. Many are saying this seems to be COVID-like symptoms. But it's not, of course, COVID. But is there any link? What is this outbreak across the country? We are being joined by a panel of experts to get us more details on what this exactly is. I'm being joined by Dr. Vivek Nangia. He's the Principal Director and Head for Pulmonology. Also, Dr. Anurag Mehrotra, who is the Chairman of the Sidh Hospital and the COVID Task Force coordinator as well. Thank you for joining us. Well, first to you, Dr. Okay, we don't have Dr. Vivek. I'm sorry. We have Dr. Anurag Mehrotra as well as Dr. Anita Ramesh, who's a clinical trial specialist. Thank you for joining us. Well, first to you, Dr. Anurag Mehrotra. What are the complaints that you're getting from the patients?
Good morning. Thanks for having me on the show. This season, within the weather changes, is known for more of viral infection and upper respiratory infection is a known fact. And many of the time, patients who are compromised heart functions, or the patient having COPD, or patient having asthmatic problem, are prone to develop severe disease because of these viral infections. What we are seeing this time is infection is more, and this type of complication leads to the hospitalization. What we are seeing this time is this infection is taking time to get resolved. Symptoms are more severe. Symptoms persist. Lingering symptoms like chronic cough, like cough for a prolonged period persist even after getting full treatment, patient recovery, physical recovery of the patient. Other important aspect which is different this time is we have seen more of fungal infection than with patients. So is it normal or is it related to the COVID epidemic we had in recent past? Any epidemic, whenever it happens, the effect of that particular epidemic persists for some time. It takes time to appreciate the complete spectrum of the symptoms and the effect of particular epidemic. I suppose we are passing through that phase. The question you asked is whether it's different this time. Yes, it is different.
Right. Dr. Anita, let me get you in at this point. Dr. Anita, scientists, doctors now saying much of these symptoms seem to be COVID-like symptoms. Is there concerns about how should the ordinary people be looking at this?
Yes, see, thank you again for bringing this into discussion. I think now this is a major health problem in India. I myself have many of my cancer patients admitted and many colleagues out in the hospital with the same symptoms. It's somewhat like COVID. Patients have fever, they have cough, they have breathlessness, tiredness, dehydration, and few cases of diarrhea. It is not life-threatening, may not need hospitalization, but yes, some of my patients have got admitted one of them in ICU because they have severe breathing difficulty. Continuous cough comes out, it is non-productive cough. Yeah, some of the symptoms like the upper respiratory symptoms, pain in the throat, fever, cough, breathing difficulty mimics COVID. But for all of them, we have done the COVID test. Most of them are negative. All of them are negative. In fact, a couple of them are H1N1 influenza positive. And so we suspected them as, say, swine flu or influenza. As on today, the data what says for ICMR, there is a influenza. It's not COVID, but another strain which is running in India, and it is spreading from state to state. Many people are getting infected, and it may be H1N1, it may be H3N2. There's another strain, H3N2. So, but one important thing is that it is not as dangerous as the first COVID. You don't need hospitalization, you don't need ventilator, you don't need ICU care, and there is no mortality. It subsides, the acute phase subsides approximately a week's time, but you still continue coughing for 2 to 3 weeks because of the inflammatory changes in your lung. So that's what it is, and many patients are getting infected with this influenza type of viral pneumonia, which is spreading.
Right. I'm also being joined by Dr. Vivek Nangia, who is the Principal Director and Head for Pulmonology at Max Hospital. Thank you, Dr. Vivek, for joining us. So, Vivek, Dr. Vivek, how are you, what are the kind of cases that are coming in? What are you telling patients? Even with the doctors, you're saying that, there's prolonged coughing even after patients seem to have recovered from fever. What should people really be doing in such cases at a time when, this is the fever, flu, influenza season?
Thank you for having me on your show. Yes, it is. There's a major surge in the number of cases coming to us with flu-like symptoms. Most of these patients are coming with complaints starting with sore throat, cough, cold, fever, severe body ache. All these symptoms are lasting for almost 5 to 7 days. After that, cascade is still persisting in their upper airways and into their lungs, and causing severe cough. Some people are even developing breathlessness, choking feeling, chest pain, tightness, all of that. Now, what is more important is watching out for any secondary infections. Quite a few of them, especially those who are in the high-risk group. That would mean those who are in the extremes of ages, elders and very young children, and those who have any kind of a comorbidity like diabetes, hypertension, heart disease, cancer, those who are on immunosuppressive therapies. All these people are more vulnerable to developing secondary infections as well.
So what should they do?
Amongst the secondary infections, besides the bacterial, we're also seeing fungal infections quite commonly in such patients. So these patients really, what they need to do is first get themselves tested for the influenza virus. If you're able to identify the specific influenza virus like H1N1, influenza A, influenza B, then probably treating them with the antiviral drug, which is easily available and quite cheap to take and easy to tolerate as well, should be the first step. Second should be they should isolate themselves immediately, because it is highly spreadable, communicable kind of a disease. So we should prevent it from spreading it to the other members in the family. So, the classical history that we're getting from patients is that one started coughing and then the rest of the family members also start to cough and develop similar kind of symptoms. So it is very important to isolate them also immediately. At least the isolation period should be 5 to 7 days to prevent the spread to the others. And then, of course, take symptomatic treatment in the initial few days. And if it still doesn't settle, then probably seek your healthcare practitioner.
Right. Thank you, Doctor.
In the meantime,
Right. Thank you, Dr. Vivek. Dr. Anita, doctor makes an important point that it spreads pretty fast. You need to isolate yourself, but practically speaking, what do people do? You're going to work spaces, you're working in close spaces, close contacts are there. So practically speaking, what are the precautions that can be taken?
Yes, practically the same COVID principles holds good. In hospitals, when we are working, we all wear still masks, we maintain our distance. We tell the people who are coughing to use the cough etiquettes during the coughing. The mask is also again mandatory. We do isolate these patients, and if in the working area, if somebody gets this, we tell them, please take rest and come back once you're all right. Maybe 7 to 8 days of rest is needed till. But we don't know actually what is the infectivity, what is the R factor, how long it takes. We don't have the data with us, but still precaution holds good. All those positive prevention rules of COVID has to be applied now, and I think it's very mandatory.
Right. Thank you very much, doctors, for joining us on this discussion. I hope the viewers get some help from this. It's, of course, a time when influenza cases are on the rise across the country.